there's another issue with that is that there was conflicting information coming from the federal government. Some say wear masks, some say don't wear
It
masks.
was like that, yeah.
So that was very, if you're watching these episodes on TV every day, you're getting conflicting information.
Still.
And
We're
that's
about
if
to
you're
open
getting
up
that.
the country on Easter, you know, so that didn't help at all either. But one more thing, if I live in a place that I can see Targets, there's a line of at least 100 people every day standing in line to get food. So when you have to function and look towards fulfilling your basic needs, trying to go to the primary source, sometimes which is not reliable, to get the information is not something that becomes a priority.
Yes, Sarah, do you have anything that you want to add right now? I didn't want to ignore you over there.
Oh, no, thank you. No, I mean, I think really, I don't know the extent of like how much people were like pushing back against the guidelines. I think it really is an issue of people having to go to work. In terms of, you know, many people have the luxury of sitting home and working, but, you know, there's a real dichotomy when it comes to race in this country, race in New York City, in terms of who is doing the work where you actually have to go in, take the subway, take the buses. You see the statistics about MTA declines in service, and in the South Bronx, it hasn't declined at all. Whereas in Manhattan, you know, the service, the usage of MTA has really declined a lot. So I really think that's the major thing we're really looking at. It's the same factors that have contributed to the chronic diseases that are, you know, putting people at risk, and it's compounded by the additional exposure together with the risk from the chronic diseases. And it's all just you know, very unequal situation that
I'm wondering though, when we're looking at, thank you for that, when we're looking at underlying health conditions though, meaning I'm wondering, is there any apathy in our community? First, understanding that the African American community is not a monolith. I want to make sure that that's clear, but is there apathy related to the distrust that is a really significant problem in terms of our being activating? It's just a question. I mean, I think about those voices, and Phyllis and I have had this conversation where there's still many in the African American community who will say, oh, I ain't even worried about voting because it just doesn't make a difference. I think right now we can see how important voting is. So since the system is not going to change quick enough for us to stay alive, what do we do to make sure we stay alive? Dr. Sweeney, you want to respond to that?
I do want to, but I want to also talk about apathy, but there's also fatalism.
Okay, fatalism. Okay.
There's fatalism. And then there are things that people don't want to do and don't want to face. And the minute they don't want to do what their part share is, they leave it in the hands of the Lord. So it's a combination of factors, both the very real ones of making sure that they can put food on the table, going to work. How about this one? Working remotely. How many MTA people can work?
Right.
Bus drivers can work remotely. Many people in our community can't work. Home health aides, how many can work remotely? So already it puts us at a disadvantage. And then when you come to like some of the people I know, they just went to their house in the Hamptons or their house in Sag Harbor or someplace like that. So we're at a disadvantage when it comes to that, because many of us don't live in 8-room, 10-room house where there are only 2 people. So here's what we can do. I'm just going to list the things and then we can talk about them as people have questions. If you've been exposed or think you've been exposed, you can quarantine. Quarantine is taking healthy people and putting them aside, away, and isolating them from other people until you know if they have the disease or not. So quarantine is for the healthy people that may have been exposed and you put it aside. It used to be 40 days because it came from ship days.
Mm-hmm.
And so that's what you do. If somebody has the disease, you isolate them. They have to be in a separate room. If possible, use a separate bathroom. If not, use wipes, the Clorox wipes for everything, or Lysol if you don't believe you're going to get corona from it. Use that to wipe down the bathroom after you've gone to the bathroom. So that's isolation and quarantine. Social distancing. There's somebody who's suggesting we start saying physical distancing so that people don't isolate people who. Social distancing is one thing when you're out on the street. Physical distancing is what it is, because you want people not to be isolated. So they should use what we're doing here, and they call it psychological, to keep your mental state good. So hand washing, my hands are so rough now that you could use them.
Everybody,
I'm telling you. And soap and water is best, but if you don't have soap and water, your sanitizer. And when I was going around the park this morning, I saw a bottle about the size of an alcohol bottle, like 750 mLs, that said, hand sanitizer, do not drink. But if you have the choice, use soap and water first. And the other thing is, try to stay informed. Wear masks, even though they were saying yes, no, maybe. Wear masks. And even when I'm walking around the park, if somebody gets close to me, I walk 6 feet away from them. So those are the things that we can do. Isolate if you're sick, quarantine if you've been exposed or think you've been exposed, hand washing, more hand washing, wearing a mask, taking care of your mental health. I went out when I was on quarantine because I covered my face, covered my arms, covered my hands. I did everything right. So I went out for exercise every day. So exercise is very important for your mental health. Walking, I don't mean you have to do anything special or go to a gym, but mental health is a big issue. I've heard more loud voices in my building during the last month than I've heard the other almost 4 years I've been
You're
here.
talking about quarrelsome voices when you say loud voices.
I'm sorry?
Quarrelsome voices. Phyllis, you were right.
you know, so let me just say, yeah. I completely agree with Dr. Sweeney. I completely agree. There's another test that we should be doing as well, just in terms of like how we think, how we go through this and how we process this. We need to all ask ourselves how close this disease has gotten to us. And not just in terms of contamination, but with respect to death, right? And use that as a barometer for how close we are to poverty and racial inequities and disparities in this nation. And there's a test, and those of you on this on this show tonight may know it, right? Where it's like kind of like where you stand sociologically in the world, and it's like, okay, did you grow up in a household where you had 2 bedrooms? Did you grow up in a household where you had 2 parents? Did you grow up in a household where one parent went to college, you have a parent who went to grad school, and it's you move up and down and back and forth based on these different questions? Well, we should ask ourselves, how many of us know somebody who died from coronavirus? How many of us know 5 people who died from coronavirus? And not just know, but know. And that is your barometer for race and wealth inequity in America. And if you have less than, I'm just going to go with, if you have less than 5 people who you know directly, then you are probably somewhere in that 1%.
Yeah.
And when you start getting into 10 and 15 and 20, it tells you something about the neighborhood, your associations, right? And we need to start using that as a barometer for how we think about who is impacted in this world and what we are doing, what that 1% is doing compared to the other 99%.
Absolutely. Absolutely.